Hello, everybody. Welcome to Morning Moments with Mel. And by the time I post this, it'll probably be afternoon. This morning, I'm not going to talk about politics. I'm not going to go down that road today. But what I do want to talk to you about is oral pharyngeal cancer. And I'm dressed like this because this is Oral Cancer Awareness Month, the month of April. And as most of you know, last July, I went through surgery because I had oral cancer. And I want to talk to you about the journey I went through. And I'm doing this video because if it can help save someone, if it can help someone discover that they have an oral cancer, the best cure is early treatment, early diagnosis and early treatment. I encourage everyone, whether you're 8 or 98, to have an oral exam every year. That could be through a dentist, it could be through an ear, nose, and throat, it could be through an oral surgeon, but make sure you get your oral exams every year. My story begins about a year and a half ago, and from time to time, I would notice that I felt like I had a breadcrumb stuck in my throat, but it was occasional. My symptoms were really nothing to write home about. I mean, they were occasional, and it's just something that normally you'd probably dismiss. Um, so it felt like I had a little something caught in my throat. And then at some point, I would replay just the beginnings of my YouTube videos, and occasionally I would sound hoarse. And I have a lot of allergies, and I thought, oh, well, maybe it's just sinus drainage or something. And then occasionally I'd wake up with a a sore throat. Now I snore heavily, and I thought maybe it was due to snoring. And occasionally I get like a little pain or something in my ear, but it didn't last long. And occasionally a little twinge on the base of my tongue. But I really thought, And then I have a really strong gag reflex. I gag really easily. And when I would try to floss in the back of my mouth, I would gag. So I bought a water flosser. And that's an incredible thing. Everybody should have one. And I would water floss. And occasionally when I would like floss like my teeth in the back, I would notice a little blood. And I thought, well, maybe there's something with the gums, but it didn't happen all the time. Um, and I'm really not, I go to the dentist, of course, but I'm not fond of it because I gag so easily. So one morning I was getting out of the bathtub. I take a bath every morning for 15 minutes. Gotta have that meditative moments in the bathtub. It helps me for the rest of the day. But anyway, when I was getting out of the tub, I thought, I feel something like breadcrumbs stuck in my throat. I was clearing my throat, it didn't go away. So I was brushing my teeth. I noticed a little blood, and I put the toothbrush back where I thought I felt this little something stuck in there, and it came out bloody. Now, because I gag easily, I'm not in the habit of, opening my mouth and putting a flashlight there and checking for things, but I did that morning. And when I did, I saw this gnarly looking thing on my tonsil. There was this black thing, it was about a little smaller than a pea, and there was something beneath it. And I told my husband, I want you to look at this. And he did. I called a dentist friend of mine, and he said, take a picture of it. Well, do you know how hard it is to hold a flashlight and take a picture of your mouth? My husband told me. So I called my dentist friend. I sent him a picture of it. He says, I don't know what it is. But he had a friend who's an oral surgeon. So I went to see the oral surgeon. Before I went to the oral surgeon, however, I went to the immediate care center. And the doctor there said, oh, it looks like a blood clot. It's really probably not that much to worry about. Go see an ENT. Don't worry about it. Well, I didn't like that answer. I did not. And I've learned through this journey that you have to advocate for yourself. That's a must. Because he said see an ENT. Well, that would have taken me 3 months to get an appointment. He never examined, he looked at my mouth, but he never took his finger and palpated it or anything. Just I mean, the whole appointment lasted maybe 3 minutes. And they charged me like $75 and my insurance copay didn't cover. So I took a Q-tip and I was kind of digging around back there and the blood clot came out. But I'll show you a picture of what it looked like. And this is the blood clot. It's kind of gnarly looking. So if anybody out there has a weak stomach, don't look at this picture I'm about to show you. But that is what it looked like in my mouth. If you can see it, I don't know if you can. It's hard to see on this with this lighting. But anyway, so as I said, I went to the oral surgeon, and by that time the blood clot had gone, and it was really irritated, and so the oral surgeon looked at it and said, it looks really irritated, and I said, well, I got the blood clot out, and so he said, I'll tell you what, take some antibiotics. I said, is this cancer? He said, I don't think it is. It's probably not much to worry about. Take the antibiotics and, come back in a couple weeks and see if it clears up. So I was going to Sedona with Linda Grindle, and I to teach at her seminar and retreat out in Mago. And I went, and I would notice my throat was bothering me and it was sore. And I took the antibiotics, and pretty much that gnarly thing I showed you went away, except there was one tiny spot that was a little yellow. It just didn't go away. It didn't get worse. It was just there. And I knew after I was speaking out in Arizona for, I was teaching a 2 or 3 hour class, I knew from the way my throat felt that something was wrong. And I just had this feeling that I had cancer, but I hadn't had any diagnosis of that. So in Arizona, we went to this church. I forget the name of it, but it's on a hill or cliff up there. And I said a little prayer, please let me get to the bottom of what's going on with my throat. And then we went to this Buddhist shrine. It was really, really neat. And I also said a little meditation and a little prayer there. Please help me find out what's going on with my throat. Please let it heal. So when I got home, I went back to the oral surgeon. Now, mind you, nobody ever palpated or examined with digitally the side of my throat. So he looked at it and he said, well, it's really cleared up. I don't think it's anything to worry about. Why don't you come back in 2 or 3 weeks and we'll check it over then. So I made the appointment. The spirit works in such beautiful ways. I was at my office, and one of my clients and good friend is a physician, and her sister was supposed to come in, and her sister couldn't, so she took the appointment. And I won't use her name. I'll just say Dr. Jones. Okay. And I said, Dr. Jones, would you look at this picture of my tonsil? Look at this. The first things out of her mouth were, this looks like cancer. You need to have a CAT scan and a biopsy. And I said, I've been trying to get in to see an ENT and I can't. It takes forever. And she said, I can call my primary care physician, get an order for a CAT scan. She goes, I'll set that up for you. So 2 days later, I went in for the CAT scan. I think that was on a Friday, I think. Anyway, the very next day, that was on a Wednesday, the very next day on a Thursday, one of my clients is an emergency room physician, and she came in and I showed it to her. And the first things out of her mouth were, that looks like cancer. It needs to be biopsied. So she checked my lymph nodes and I showed her the lesion in my mouth, which she said, I can't hardly see anything. And I don't feel any lymph node involvement. So she said, I said, I'm trying to get into see an ENT, but I can't. I mean, you can't get in. You have to wait 3 or 4 months. And she said, I went to medical school with the guy who's an ENT. Let me text him. He called right back. And he said, can you come on Thursday? I said, no, I'm going to Africa on Wednesday. I had a trip going to Africa last June in Uganda. I had 16 people going, and I had planned the trip for about 2 years. I thought, there's no way I'm not going on this trip. I am going. on this trip. So he said, okay, can you come in on Monday? And I said, yes. So I still didn't have the CAT scan results back. So I went in to see him and I showed him the picture. And there's this long, thin tube. It's got a camera on the end of it. They go through your nose, down your throat. They numb everything. I thought it'd be horrible, but it really isn't. You can't feel anything. And he said, I don't see anything there. And I said, I really think this is cancer. I kept saying it. And he said, well, let's don't put the cart before the horse. And, he's Dr. Neil Patel at Loyola's amazing. He's really good ENT. And when he started examining my mouth and he started pressing on the tonsil, his whole demeanor changed. His whole energy changed. His facial expression changed. And when he finished, and then he kept re-examining it. And when he finished, I said, doctor, you don't have a good poker face at all. And I felt your energy change. He knew what I did for a living. And he said, I'm going to be honest with you. I feel a mass behind your tonsil and it's large. And I feel this is cancer. And he said, how long are you going to be going to Africa? And I said, 9 days. I said, if you tell me I can't go, I'm going to go. He said, 9 days isn't going to make much of a difference. So when you get back, we'll biopsy it. Okay. I went to Africa. Needless to say, I was petrified. I was afraid. I really cherished the travelers that came with us because they were so supportive. And I really didn't talk about this much, but they all knew I was afraid. But I guess I tried to hide it well. I probably didn't. But on the way to Africa, we were flying to Amsterdam and I was in the bathroom, crazy place. And I'd already announced on, to my YouTube channel that I had cancer. But I was in the bathroom, this amazing sense of peace came over me. It was incredible. I've never had anything like that happen in my entire life. And even though this part of me was worried and afraid, this part of me said it's going to be all right. And I don't know if I came to terms with it, but it was so healing and just this wonderful feeling. And that helped me through this whole thing. When I went back to my seat from Amsterdam going to Uganda, or actually Tanzania, then Uganda, I was sitting next to a lady and she had an accent. And I said, where are you from? And Germany. And she was a surgeon and she was going to Tanzania to do oral surgeries. And so I told her what was going on. And we're on an airplane. She goes, let me look in your mouth. I got that. I follow you. We're on an airplane. She's feeling like this. My great niece was sitting 2 rows back and she texted me, what are you doing? Anyway, the lady said, this is probably, she said, I don't feel any lymph node involvement. This is probably HPV cancer. If it's in the early enough stages, it's very curable. And that made me feel really good. And I would see these little signs all through Africa, like don't give up hope, all kinds of little encouragements. The trip to Uganda was absolutely the best trip I'd ever had, but I was afraid to say it was the best trip that I'd ever had because I thought it would be the last trip I'd ever had. So the frightening part of this was not knowing. You don't know if the cancer spread. You don't know how big it is. You don't know what kind it is. Every time you cough, you think, oh my God, did it go to my lungs? Every time you sneeze. I mean, it's normal. And the hardest part for me was not knowing. Somebody told me that. I'm like, yeah, well, I know it's cancer, but I didn't know what type or anything. So the trip to Africa was amazing. When I got back, I went to see Dr. Patel and he biopsied this. And he said, even if the biopsy comes back negative, now I want everybody to hear this, even if the biopsy is negative, that doesn't mean anything. Because in the office, he couldn't go deep enough to get a good sample. He said, so if it comes back benign, he said, I will have to put your anesthesia under anesthesia and go deeper to get a deeper sample. And I said, okay, fine. So now I'm waiting for the biopsy results to get back. 3 days later, on my chart, I saw that it was P14 or P16. I can't remember. And in P40, I just don't remember. And then I was freaking out because what do those protein markers mean? So I called my doctor friends and they were like, they're protein markers for cancer, but we're really not familiar with some of them. So I Googled them. Don't go to Dr. Google. But it said human papilloma virus, HPV. Okay, fine. So meanwhile, back at the ranch, my friend Beverly, and she's also a wonderful medium, Beverly Kirby, so make sure you get an appointment with her. She's a flight attendant, and she was on an airplane coming from Rome, I think, coming back to Chicago, and there was a passenger on board, and Beverly and the passenger started talking, and the passenger said that she was a head and neck physician in LA, and Beverly told her about my recent diagnosis at that point. And she said, "Who's his doctor?" And so Beverly is texting me from the airplane, and I texted her back, Dr. Kirsten Stenson at Rush in Chicago. And the lady answered back to Beverly, "Oh my God, I know her. She's incredible." Okay, that was synchronicity. My cardiologist, I told him about it, obviously. The first words out of his mouth were Dr. Stenson. She used to teach here at University of Chicago, but she's since gone to Rush. That's a huge university cancer center here in Chicago. When I went back to the oral surgeon, I said, "This is cancer. Here's what's going on." He said, "Dr. Kirsten Stenson." My doctor recommended her. 5 different doctors who didn't know each other recommended Dr. Stenson. My dentist had oral cancer, I think 15 or 20 years ago, or at least her partner did. And when I called her about it, she said, Dr. Kirsten Stenson. So all these people. So I called to make the appointment. I had the CAT scan results back. And I think I had a biopsy back then by then. And they said, this was at the end of June. They said, she can't see until July the 17th. And I said, well, I was just diagnosed with pharyngeal cancer. I really want to get it. I want to get in to see her. She's came highly recommended. My friend Beverly said, Mel, when you see her and if she touches your hand, you'll know if she's the right doctor for you. I said, okay, because it's okay to doctor shop. It's okay to get a second, third, fourth opinion. If you don't like the opinion your doctor gives you, get a second opinion, get a third opinion. Look how many I got. And thank goodness, because me and the universe being proactive and kicking me in the rear end and saying, get moving on this, Mel, it saved my life. So you have to advocate for yourself and be proactive. And if the doctor or anybody tries to gaslight you, in other words, saying it's your fault or it's in your head, nothing to worry about, blah, 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 and you express your concerns and they continue to gaslight, change doctors, get another opinion, whatever you do. So back to my story. So I called Rush and I said, I was just diagnosed with oropharyngeal cancer. And they said, come in, on July the 17th. This was the end of June. I said, I can't wait that long. They said, we'll call you back. 2 hours later, it was a social worker calling me from there. She was incredible. We understand you've just been diagnosed with oropharyngeal cancer. When you come in, can you come in tomorrow? Bring your CAT scan results. You'll meet with Dr. Stenson. And she said, if there's anything you need, like acupuncture, massage, therapist, let us know. We'll handle all of that for you. It was incredible. It was, I'm going to cry. It was a total holistic experience. It wasn't just treating the cancer. It was treating my psyche. It was treating my soul. It was treating all of me. So I went to see Dr. Stenson, and she came in the room. My friend Beverly Kirby said, you can't touch your hand. I go, how the hell am I going to touch a doctor's hand? And she put her hand out, and she put her hand on top of mine. And she said, Mr. Doerr, I'm Dr. Stenson. And I said, no, please call me Mel. And she said that I'm Kirsten. So I explained to her my story, the quick version, and I was crying. And I said, I'm so sorry. She goes, it's okay to cry. We all cry around here. And she was just the most loving, caring human being. And she's also a brilliant surgeon and an excellent physician. So she spent about an hour with me and she said, she explained everything. She goes, now let's go look at the CAT scan. And she's going down through the different slices. And I said, what are those white things? She goes, oh, that's calcification, your coronary arteries, which I knew I had already. And then when she got to the tumor, she said, here it is. You can see it. And it was really big, or at least in my mind was, blah, blah, blah. And when she finished, I said, is this a stage 4? She said, no, here's the lymph nodes. I don't see any involvement, but that doesn't mean anything. We won't know till we get in there. But she said, this is very curable. I walked in there thinking I was dying. Um, and I walked out thinking, wow, I can beat this. We can beat this. So I said to her, is this a stage 4? She goes, oh, no, 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 no. I'm calling this a stage 1. I said, with the tumor that big? And she said, yes. I said, well, how big is it? And she said, right about from this joint to the top of your thumb and about that wide. So imagine that. Um, and I said, well, how long do you think it's been there? She said, 6 months, a year, maybe. And she said, I'm convinced that this is HPV, human papilloma virus. Uh, it causes cancer. And back in my day, we couldn't get the shots, the vaccines to prevent HPV. And so, fine. So she said, I want you to meet with my entire team, my cancer team, the radiation oncologist, the medical oncologist. She said, a speech pathologist. I want you to meet the whole team. And she said, we have our tumor boards. They have actually a board of doctors that meet and talk about the tumor and how to treat it and what they're going to do. And we'll go through that. And she said, we're going to set up your surgery for July the 17th. That was 2 weeks later. When God was handing out patients, I said in the attitude line, I'm not real patient. So for somebody with OCD, it's like, well, God, I gotta wait 2 weeks. I'm glad I did. It gave me time to prepare. My one doctor friend said, go out and eat the biggest steak you can have, because trust me, for a long time, you're not going to be able to eat one. What did I do? I went out and had a huge steak. So anyway, she explained everything that she was going to do. And she said to me, you have options. Now, if anybody has cancer or any disease, you don't have to become that disease. Remember, you do have options. And to me, that was so incredibly empowering. And I started crying again. I'm like, you mean I have options? And she said, yes. And here's the options. You can have radiation, and that's equally as effective in getting rid of this cancer. She said, but it can have some long-term negative effects. She was being nice. Or you can have robotic surgery. I don't do that. We have a great team that does. Or you can have the regular surgery. And I said, I want the regular surgery. And I went in. And she said, thank you for your confidence. And she explained to me everything they were going to do. So I went in July the 7th. They took the tonsil out. The tumor behind it, as I said, was this size, but she got clear margins on it. She had to reconstruct the inside of my mouth, taking buccal fat, that's fat from the cheek. She made an incision on the inside. This was all done from the inside of my mouth. And she closed the wound. Then she took a graft from the back of my throat to close the wound. And then to reconstruct part of the muscle she had to cut through. All that on the inside of my mouth. Here, this scar is where they took out 13 lymph nodes. And she explained to me that they take out the lymph nodes, even if the CAT scan doesn't show any lymph node environment, there could be some small cancer cells in there. They just want to make sure they're clean. So my lymph nodes were all clean. Now, before my surgery, she had me meet with her team. I met with a radiation oncologist, and he went through my whole CAT scan thing. And he said, I really don't think you're going to need radiation. This doesn't show up in the lymph nodes. I was like, yes. Now, if it does, he said, then you'll need radiation. And that would probably be uh, a treatment once a day for like 5 or 6 weeks. I'm like, okay. Then I meet with the speech pathologist. So he's telling me how it's going to be difficult to swallow. And believe it or not, water is the hardest thing to swallow. Anything with that viscosity, because it gets stuck in the back of your throat. And if you're not careful, it can go down to your lungs. Furthermore, if you drink it too quickly, it'll come up through your nose and come out through your nose. I'm like, okay, all right. Then I met with a medical oncologist, and he told me this HPV kind of cancer over a certain age group is epidemic because we couldn't get the shots back then. Human papillomavirus. It can cause cervical dysplasia in women as well. And about 90% of us are infected with it. We just don't know. So I got all the explanations. I had the surgery. And, I was paralyzed. I really was afraid, but I didn't let anybody know that. And I said, okay, Spirit God, help me through this. And the message came back, don't let the fear stand in front of you. Let it get behind you and push you forward. Okay. I made some people promises that right after surgery, I would call them. And when I woke up from surgery, I got to my room, I called them and I go, do you know what you're saying? I go, yeah, I promised I would call you. I was like Chatty Cathy. I think I even did a YouTube video. I look at it now and I go, oh my God. Because, you're coming out of surgery, you've still got all the happy drugs in you. You're not feeling any pain. It's like, okay, this is not so bad until the next morning. They gave me broth and I took it too quickly, came through my nose. They wanted me to give me this big pill. I couldn't swallow it. So they had to put it in the IV. It was the antibiotic. Swallowing was really painful. But what I would do is, because I have something called the redhead gene, and I metabolize like any kind of anesthesia, or when they give me a shot at the dentist, they have to give me 3 or 4, because this redhead gene, we metabolize this stuff quickly and it takes a lot more to numb us up or knock us out, if you will. So if I take a pain pill, it was supposed to last for 6 hours, it would wear off in 3. So what I did was I had tramadol. This was at the hospital, and I asked them if I could have one. And then 3 hours later, they would give me an oxycodone, and then 3 hours later, a tramadol. And that managed the pain. But when I would try to eat, I could only open my mouth like that. And only what I could get on the end of a teaspoon. I had to mush everything up. And, I lost 13 pounds in 2 weeks. It would take me 2 or 3 hours to eat. But I didn't give in to it. When I went to see the surgeon 3 weeks after all of this, I said, Dr. Stinson, I'm trying to get more solid food into my diet. I'm smushing it up. I'm trying to open my mouth more, but it's difficult. And she said, that's incredible. I said, what's incredible? She said, most people 3 weeks after surgery are still on liquids. And I said, that was too difficult. The easiest thing for me to swallow and that felt good was mashed potatoes, warm mashed potatoes, or warm macaroni and cheese. And then at night I would have Jello, because the cool would help as well. So I lived on that for like a couple weeks. But I made up my mind. On the way home from the hospital, I told my husband, I'm hungry. I want a quarter pounder. He said, I think you're high. I said, probably, but I want a quarter pounder. I don't eat quarter pounders that often. So when we got home, I smushed it up. It took me 4.5 hours, just teeny bites. I think I wanted the pickle more than anything. So I got my quarter pounder. Couldn't eat the French fries, though. I had to give them to the dog. Shh. When I gave French fries to the dog, you're not supposed to get people food. Anyway, so in the beginning, she told me that if I didn't eat, they would put a feeding tube in. And the feeding tube can either go right into your stomach or through your nose, down through your throat. It's called an NG tube. And I said, oh, no, 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 no. We're not going through that route. I mean, if I would have, sometimes it felt like I was swallowing razor blades, to be honest with you, but I was like, no, I am going to eat. I don't care what it takes. So that's what I do when I get home. I take a pain pill, I'd wait about an hour, and then I would eat. So when I went to see Dr. Stenson, uh, I had to do exercises because when they move this nerve around and they reconstruct the muscle here, this nerve controls shrugging. And going like this. So I had to do my own physical therapy like this, raise my arm like that, massage this 3 or 4 times a day, neck exercises, turning. It's still a little stiff, but that's, I guess, normal. So I did all of that. Um, sometimes it hurt, but I did it. Um, so, after 3 weeks, so I said to Dr. Stentz, I'm having trouble opening my mouth. And she was like, okay, we're going to order this thing, whatever it was. I call it the torture device. You'd put it in your mouth and you would squeeze and it forces your mouth open. And each day you do it by a little bit of a millimeter or more until you can essentially open your mouth because it keeps scar tissue from forming. Now, me having the gag reflex I did, I put it on my mouth and go, but I got through it. Now I can open my mouth. That's as wide as I can get it. But what I do each day now is exercise it and pull a little harder each time, and that helps. Luckily, I didn't have to have chemo. I did not have to have radiation. Mine was taken care of with surgery. I have to have a CAT scan every 2 to 3 months. In addition to that, a scope where they look down. The last one I had, I said, numb me really well. And when Dr. Stenson finished, I said, did you notice anything? And she said, yeah, you didn't gag, because normally I was gagging. It was horrible. So I call that scope thingy my new best friend. The CAT scan didn't show any lymph node enlargement. It didn't show anything really other than some scar tissue from where they did the surgery. They told me it would make my turkey chin worse. And I asked her if she could just learn to maybe do this side. And she goes, I don't know how to do that. I go, could you learn in a couple of weeks? So that made it a little worse, but better turkey chin than cancer. So I'm still going through my story. It's been, I think, 8 months, and here we are. I'm alive and well. So to all of those about to be diagnosed or newly diagnosed, don't let the fear get in front of you and hold you back. Let it get behind you and push you forward. It doesn't have to be a death sentence. It's a very, very, very frightening word. But my sister said to me, you don't have to become the disease. And she was right. And that helped so much. So here's the things to watch out for. If you feel a lump or swelling in your neck, get to the physician immediately. And they might, if they say it's a cold, it's the flu, whatever. But if that lump stays there, follow up. Follow up with an ENT, ear, nose, and throat. Follow up. Because Dr. Stinson said normally when people realize they have this type cancer is because they have a swelling on their neck. And when they go in, it's a lymph node. And that lymph node has cancer in it because from maybe a tiny primary spot in the mouth, the cancer has metastasized. To metastasize means to spread. It spread to the lymph node. And normally that's when they find it. And normally if they do that, if they, wait till it goes in a lymph node, then they're looking at chemotherapy. They're looking at possibly radiation. She said, Mel, you were lucky because yours went the other way. It came out on your tonsil. So any swelling in your neck whatsoever, get it taken care of. Don't assume it's a lymph node, it's a cold. Get it taken care of ASAP. And if the doctor thinks you're being overreactive, change doctors. You don't have to apologize to anybody because you're being diligent about your health. If you feel like a pain in your ears sometimes, or mine was if I was eating something like vinegary, I could feel it running up. I guess it was the tumor putting pressure here. I didn't have any pain with it at all with the tumor. And sometimes you don't have pain until, occasionally when I was drinking water, I would notice I had a hard time swallowing. Since I've had the surgery, I don't snore anymore. So that must have been affecting snoring, you know. Um, Sometimes I'll feel like something stuck back there, but Dr. Stenson said that because there probably is, there's still a lot of folds back there. So if you notice any sort of irregularity on your lip, on your gum, on your tongue, on your jaw, on your throat, on the uvula, that little thing that hangs down, don't take it for granted. Get to an ENT. Anything out of the ordinary that you see in your mouth or your throat, get to the doctor. So if you have those symptoms I've talked about, hoarseness, sometimes the feeling of something caught in your throat, a swelling in your neck, any of that, have it taken care of. It very well could save your life. For those of you out there watching this, and if you're newly diagnosed or just about to be diagnosed, if you need somebody to talk to, call my office at 847-590-5411. And I can tell you more what it was like for me. Meanwhile, thank you everybody for watching this video. I hope that it helps many of you, and I hope it can save some lives. This is Oral Cancer Awareness Month. Tomorrow I'll be on, tomorrow Linda Grenda will be on my channel, and I'm going to start doing a lot more morning moments with Mel. This Thursday, I won't be on with Kevin Chandler because he's got some fun stuff going on. Tuesday, I'll be on with Psychic Arthur. Wednesday, Kim Copeland. So anyway, I'll get back to the politics in my later videos. I wish you all well. Cancer Awareness Month, Oral Cancer Awareness Month. Thank you for listening, and I hope you have a wonderful day. Aloha and namaste.